Good evening to all. Today we are going to discuss the topic safety in sports. So this is a chapter in physical education of 10th class ICC board and also beneficial for the sports persons, those people are involving in various games or sports. So the topic is safety in sports and meaning of sports medicine. So whenever we are playing or participating in any kind of game, so many people or players can met with the accidents. The accidents can be happened anywhere to anyone anytime. So due to that accident, the person can be injured from the muscles or bone or skin injury. So whenever any kind of injury is there, so behind that injury there is a long story. So what is a long story? So whenever we are meeting with the accident or injury, so it will not happen immediately. Like if you injured in a football or hockey ground, maybe the injury of muscle or joint, behind that maybe a story of that you are not performed a warm up, maybe you are not performing a rule and regulation, maybe you are not wearing a safety equipment. So immediately we are not meeting with the accident or injury. Behind that some reasons are there, so we are going to discuss that reasons only. So here we will talk about meaning of sports medicine. So what is a sports medicine? So sports medicine is a branch of a medicine, general medicine we can say. What is different from other medicines? So why it is different? Because whenever we are sick or ill, we are taking medicine for that purpose only. Before any kind of problem, we are not taking any kind of medicine. So we are not talking about any kind of medicine before we got sick or getting any kind of problem. Here I will include that the sports medicine. This topic, the sports medicine, it is highly deals with the first aid, treatment, curing, prevention, diagnose, and rehabilitation of the injury. Those are related or caused by sports. So first of all, the first aid. If a person get injured, how to give a first aid? Like if the injuries of bone injury, how we can come to another bone injury? Whenever a person is fell down in a ground and there is a too much pain in the particular area, so maybe there will be a bone injury. And whenever bone is broken into two pieces or more pieces, and it is making two sharp edges. So like this, when bone is breaking, it may be more sharp edge. If we will move the particular part while the injury, it can cut the veins and arteries, which can be lead to internal bleeding, and that can be highly dangerous for the life of a person. So whenever we are going to give a first aid, we must know about the sports medicine or the particular first aid for particular injuries. So what we should do whenever any sports related injury or any injury, we should restrict the movement of particular part. If arm is injured, so we should stop the movement of arm. So mostly we are using the Thomas splint a sling hanging over the neck to restrict the movement of arm. So many people have seen that particular position of person when they got injured or injury of bone, the fracture. So like that, the first aid must be given by the professionals. If you are not knowing the first aid step for the various type of the injuries, don't do that. So second thing, the treatment is also given by the professionals, and the right treatment must be there. Like whenever any muscle related injury, that time the muscles can be torn due to high temperature increased in the particular part. So if immediately we are using any kind of ointment like some kind of gels in the market, combi flame, Bolni gel, move, so various sprays are there. If immediately we are using, that can be lead to inflammate the injury can be increased. So what is the first aid step? In the starting, we must use the ice pack or cold water pack to reduce the temperature of particular part, and it will reduce the swelling over that particular part. So we should know about curing, how to cure or prevent the injuries, and how to diagnose. Like I told you that the person must be knowing whether there is a bone injury or muscle injury or any other kind of injury. So diagnose can be done by the professionals or the people those have a knowledge of sports medicine. So rehabilitation is also important, because a person is not taking proper rest, it can't be rehabilitate, and person can't be able to participate again in the game. So rehabilitation also done in the proper manner, take proper care and rest. So here we can say that the sports medicine is a subject which provide us a wide knowledge about preventing, curing, diagnose, first aid of the sports related injuries. So here we will discuss today sports related injury. Before that, we should know what are the causes and the preventing step of the sports related injuries. So first of all, I will add some points. So the causes and the prevention, they both are same name. So the one cause opposite to the prevention. So first of all, causes and prevention. So causes are like I'm going to discuss the first cause: not performing the warm up, not performing, so not performing warm up. So whenever we are going to start any kind of game, so we must be perform warm up. A proper warm up will save us from various kind of injuries. If you are performing warm up, then it is very beneficial for you. Whenever we are performing warm up, our body temperature is raised, and the circulatory and respiratory system slightly increasing the speed. So because when we are going to participate in any game, our body required more amount of oxygen to produce more energy. So in that case, we must be perform the warm up. So it must be in a proper manner. So when we are performing warm up, it must be step by step from light to hard exercise. The second point I'm going to add, the cooling down. When we are get over our exercise or our activity, after that we must be cooling down our body. Cooling down like step by step we increase the body temperature, we increase the speed of our respiratory and circulatory system. Like that we must be decrease the speed of respiratory and circulatory system step by step. So that is cooling down and limbering down. So that is cause. So that is cause. Now preventing step is also warm up. How we can prevent? We must be warm up and cool down. Then we can prevent from various kind of injuries. So as per the importance of warm up, it will make our muscles also slightly flexible, easy to move, so there can't be any kind of injury. Next is fitness. So causes fitness. If a person or a player has a poor fitness level, they can easily met with the various kind of sports related injuries. Other hand, if person has a good fitness level, they can prevent from various kind of injuries. The next point of use of correct equipment and maintaining the equipment. So in various games, we required a various kind of equipments. So right equipment must be used in the right game. Like in football, we must be required the studs. In basketball, we need ankle shoes, and according to the surface of the game, we need the shoes type. So we can't play basketball with the studs, and we can't use the high ankle shoes in the football grassy area. So according to the game, we must use equipment, otherwise we will must get injured. So mostly the people are not using the right equipment while playing. So next is proper knowledge of rule and regulation. So here we can add equipment, rule and regulation. So equipment, person is not using right equipment will must be get injured, and the person those are using the equipment, they can be prevent from the sports related injuries. Next is rule and regulation. Following the rule and regulations, the person those are following the rule and regulation, they are playing a good game, and they are staying away from the injuries. And the person those are not you following the rule and regulations, they can be injured and they can injure other players as well as. So a player must be follow the rule and regulation of the game, so they can be prevent from the sports related injuries. So causes are the person is not following the rule and regulation. The next, sometime a player is not wearing right equipment or safety equipment. Right equipment we already discussed. The safety equipment. The safety equipments are very necessary. Like in cricket, the batsman is wearing the helmet, the pads, the gloves, the arm protector, the chest protector, abdominal protector, thigh guard. So various protectors are there, and in other games, playing football, wearing shin guard to protect the shin bone. In hockey, the goalkeeper is wearing the full kit, protective kit. So if player is not using the safety equipment, they must be injured. So that is the cause. The prevent is if person is wearing a safety equipment, so they can be prevent from various kind of injuries. The next is importance of resting in the workout. So rest during workout. So rest has a major role in the prevention. If a person is not taking a proper rest in between the workouts, the muscles can working continuously, and the respiratory and circulatory system is also working continuously. So there can be any problem in the circulatory or respiratory system due to regular work. And whenever we are doing any kind of exercise for a long time, the muscle can be dehydrated, the muscle mineral, the water can be dehydrated. So due to dehydration, the muscle can be face the problem of cramping due to the lack of water. So we should take a proper rest and to drink uh, sufficient liquids during the workouts. So the cause is continue workout without taking rest. The prevention is if person will take the rest during the workouts or exercise or training, they can be prevent from the sports related injuries. So next is supervision of coach and teacher. So if person is working under the supervision of coach and teacher, they must be protect from the sports related injuries, because the coach or teacher can guide them about warm up using right equipment. They will consider their fitness level, they will make them sure to play in rule and regulation. They will you tell them to use the safety equipment. They will also tell them the importance of rest and recovery during the workout. So proper training skill and techniques, if person is using proper training and skill, they can be safe from the various kind of injuries. So here we can add the supervision of the coach and teacher, the supervision of coach and teacher, then the proper training methods, proper training methods. So also in proper training method, we can add the time, the schedule of the training. Like in a winter, we can keep the daytime training in the summers, early morning or late evening. And we should not perform the exercise or workout for a long time in the summer or very hot weather or very excessive hot weather. Next is safe facilities. Safe facilities. Safe facilities are like if you are using a basketball court, it must be a good leveled, it must be a wooden floor. If you are playing football, ground must be a level, the grass must be cut thoroughly. So if there are good safe facilities, then only the person can be safe from various kind of injuries. So if there is not a safe facilities, that is can be a cause of sport injuries. And if person will use a safe facilities, they can be prevent from various kind of sports related injuries. Now we will talk about first aid. So here I will add that don't mix up sports medicine with the first aid. Don't mix a sports medicine with first aid. So first aid is generally we can saying it is a first and immediate first and immediate help or aid given to the injured or patient injured person or patient. The first treatment or help given to the injured person is called first aid. So it is before the arrival of doctor or before we can take the injured person to the hospital. So the person who is giving the first aid must take care of various steps, like a person must have knowledge of first aid. First of all, the person must have the knowledge of first aid. If person don't have the knowledge of first aid, they can be lead to the more difficulty for the patient or a injured person. Like sometimes there may be a choking due to the any foreign object, and that time we can't give any liquid to the person. Some other problems are, so first of all the first aider take care of the objectives of the first aid. So there are some general principle for the first aid, like immediate aid. Person must be give a help to the injured person immediately. Don't think about anything else. The knowledge which he or she has must be used that time. Second is think about ABC. So ABC are three things in the first aid. A, B, C. So first of all, airway. The first point is airway. So must be tilt the head and back of the patient person, so that a person must be provide a proper airway to the victim. His or her chin must be keeping up. Second is breathing. B for breathing. So the breathing can be given mouth to mouth, or rescues can be given. So person must be check the pulse also. Second is compressions. So compression is pushing the chest of the person to make that person breathe if person is not breathing. So this is a main step while checking the pulse of the person from the wrist area with pressing two fingers, or if you are expert you can check from the neck the pulse of the person. So must be given CPR, the cardiopulmonary resuscitation. The person, maybe you people seen that people are pressing the chest again and again with some intervals, so that if circulation is stopped, it must be work again. So if there is a no breathing, giving mouth to mouth respiration or rescue breeze. So there may be some other kind of injuries, like if there is a cut or wound due to any sharp thing. So what is the first step? Must be stop the bleeding by compressions, by using some kind of cloth. Must be stop the bleeding, because due to the excessive bleeding, person can be died. So it can be dangerous for the life of the person. Must stop the bleeding. Must be keep away the crowd whenever some kind of accident or injury. What the people are doing, they are gathering around the person who is injured. So in that case, the person who is injured must be need a sympathy and affection from the first aider. But the people, what they are doing, they are gathering around, and the person is already injured and demoralized. That person needs sympathy, but the people are saying that he may might be going to die no more. So some other things they are, some other words they are using. So it is not good. Whenever giving a first aid, keep away the crowd. So if any other kind of injuries, the person is drowning and you take out the person from the water, so what you must be doing, you must be keep the person warm, wrap in the cloth, and the as I use the sympathetic attitude must be used. And if person is unconscious due to any kind of injuries, don't give any kind of liquid to drink. What the people are doing, they are trying to give the water and maybe saying to sip it or to drink it. So don't do that thing. Maybe there can be any obstruction in the bent pipe, and that the liquid can be led to the more injury. Then don't be doctor yourself. As soon as possible, provide the person first aid from the nearby doctor or hospital. So take the person to the experts immediately. So now we will discuss about the sports related injuries. Sports related injuries are divided into two kind of injuries: soft tissue injury, hard tissue injury. So soft tissue injury, it is divided into two: the tissue injury, skin and muscle. So skin injuries are, there are different kind of injuries like contusion, abrasion, cut, bound piercing. So cut and bound has a another name, names like laceration and incision. Muscle related injuries: cramp, cramp and other injuries like sprain and strain. So these are soft tissue injuries. Soft tissue injuries are divided into two kind: skin and muscle. In skin injuries, there is contusion, abrasion, then cut bound. Cut bound is laceration, incision. The muscle injury is divided into three main parts: cramp, sprain, and strain. So now we will discuss the skin injury. Skin injury is, first of all, the skin injury contusion. Any hard object when hitting the body and not making any kind of cut, and the skin color turns into bluish or reddish, so that is called contusion. So there is a no bleeding from the injury, that is contusion. So the skin color is turned into bluish and red. Second type is abrasion. So whenever we are running or we are falling from the cycle or motorcycle, sometime the upper layer of the skin can be peeled off or rubbed. So there is a friction in between the surface and skin. There is a friction in between surface and skin. The upper layer of skin is removed. So that kind of injuries can be mentioned as a abrasion. So now how to treat these both injuries? This injury must be washed with the clean water, or antiseptic must be used antiseptic, and this contusion must use the ice pack or cold water pack. The treatment is cold water pack. So this kind of injuries must we use the clean water to wash the bound. Okay, there must be some kind of some bleeding, and some kind of the germs can be entered into the blood bloodstream through that open wound. So it must be wash and apply some kind of antiseptic. So these kind of injuries are also called the minor injuries. It can be treated without any kind of treatment, self-treated injuries. So within few days it can be treated. The next is incision and laceration. So incision and lacerations are the injuries which are made by any sharp edge. So sharp edge means the knife or the razor. The incision, sharp edge. Object. The laceration is made by a blunt edge object. So both type of injuries are dangerous. Sometimes the cut made by the sharp edge like razor or knife can be deeper and can be cut the main arteries of the bloodstream, can be dangerous. And blunt object, whenever blunt object is cutting the skin, the wound will be a broader, so that time must be need of stitches, so that the skin can be come closer to the each other. Like if there is a broader cut in the skin, it must be use the stitches to close the wound. So these kind of injuries can be cut the muscles also, along with the some kind of arteries. So it can be also dangerous. How to treat? Clean the surface of the skin with antiseptic or newsprint, stop the bleeding, cover the affected part. So with the medicine cotton bandage, apply bandage. So repeat the dressing pad over the wound. So apply ice and cold compressions. As I told you, if the wound is deeper or broader, must go for the stitches. So take care of the injuries properly. So these are the skin related injuries: contusion, abrasion, incision, and laceration. Now we are going to discuss the muscle related injuries. First of all, cramp. So whenever we are doing work in very hot weather for a long time, or continuously working without taking any rest and not taking proper liquids, that time body can be dehydrated. The most of the minerals can be come out from the body through the sweat. So in that case, body is not working properly. As we are knowing that 70% our body is made of water. So it means the 70% part of the each and every part or most of the muscles are made from the water. So if water is dehydrated from the muscles, muscles are not working properly, and they can be unable to work properly. Muscle can't be relax and flex properly due to the excessive dehydration. So this injury can be treated by taking more liquids and also using the cold water pack over the affected part. The next is sprain. When the tendons and ligaments broken. So where the tendons and ligaments are present in our joints, mostly while running or jumping, the ankle joint is twisted. Ankle joint is twisted, like the wrist is twisted. So the tendons which are responsible for the movement of the joint and the ligaments which winding the joint or two bones to make a joint are broken. So that time the injury is called sprain. The next injury is called strain. Muscle related injuries, strain. So whenever muscle is overstressed, how the overstressed? Whenever there is an uneven surface while running or jumping, so not warming up properly, no fitness level, not using right equipment, so person can be the muscle can be overstressed or overstressed. Stretch means torn out the muscle tissues, and stress means there can be a more stress on the muscles. So that type of injury is called strain. So what you will write in the answer when you are going to write the answer about these muscle injuries? First of all, cramp. It is an ability of muscle to work properly. So this is happened due to the lack of water in the muscle or muscle is dehydrated. Second is when the pressure, the tendons and ligaments present in the joint are broken, and the joint is not able to move properly due to that broken tendons and ligaments. That injury is called sprain. The strain when the muscles tissues present in the any muscle are overstretched, torn out, or overstressed due to the pressure, overstressed, that is called strain. So must we take rest after the injury? If further you are participating in any activity without taking rest, the injury can be lead to the more dangerous injury and can be stay for a long time. The mostly the muscle injuries can be stay for 2 to 3 weeks, and it can be treated within 3 weeks with a proper rest and take care of that particular part. The mostly skin injuries can be treated within week or 2 week. And the other hand, we are going to discuss the injuries called hard tissue injuries. So these injuries are related to the bone and joints. So there is injury named fracture and dislocation. So what is fracture? When a bone partially incomplete, completely, or in many pieces, a bone is broken in two pieces or more pieces is called fracture. When a bone displaced from its original position, like I will draw, there is a shoulder girdle and this is a wall and socket joint. This is humerus bone, this bone. So when this joint, this bone is removed from this area, shoulder girdle area, displaced from its original position, is called dislocation. We can say that joint is removed, that is called dislocation. So it can be done with due to the a violent pull or push, due to any kind of other injury with the jerky movement, it can be dislocated. So when there is a pressure over the bone while falling down, or person is stuck with any hard object with full speed, so that time the bone can be broken into two pieces. So for these kind of injuries, person must be consult with the expertise, the doctor, the physiotherapist, so that the position of the bone can be make proper for the better results by better rehabilitation recovery. So here we are using the bird for the treatment of these. We are adding the bird for the first aid. Pricer. So first of all, P for prevention, R for rest, I for ice, C for compression, E for elevation, R for recovery or rehabilitation. So whenever person met with the accident, what to do? Whenever any injury, first of all, prevention means prevent further injury, prevent the movement, further movement. Second, take care, take a rest. Third, use the ice pack over the affected part. Third, use a compression to support a part. Elevation. So must be elevate, lift the particular part above the heart level. If arm is injured, any skin related injury or muscle related, try to lift. So if there is more pain, might be a heart tissue injury, so don't move your body part, so restrict the movement. So next is elevation, means hand raising up from the heart level if there is any skin injury. So if there is a injury on the ankle joint, lay down on the ground and lift the leg with the help of any object. So like that, if there is an ankle joint injury, person's leg must be lifted high in the air or with the support of any object, like keeping any box, any other help of any person. So mean to say that if there is a high circulation to the side of injury, the injury can be increased. There can be internal bleeding. So to stop the internal bleeding or reduce the speed of blood, we are raising the particular part. Then recovery. So till person is not recovered, must we take care of your particular part. So this, the blood pressure prevention, rest, ice compression, elevation, recovery or rehabilitation. It can become as a riser also, price also, and rice also. These, and you have to write the meaning of these four words: the rice, rest, ice, compression, and elevation. So like that, you can write the answers. Now we are going to discuss shortly the causes. First of all, lack of fitness, then poor concentration. Person is not concentrating, over stress or tension, not performing warm up, equipment failure, facal- faulty skill actions, not using means of safety, not using the rule of regulations. Then there can be a wrong treatment methods lead to the various kind of injuries. So along with this contusion abrasion, we will talk about the concussion. Concussion is when a head of person is hitting any object with high speed. So what happened that time? Inside the skull, the brain is moving, going forward and backward. Due to that, the brain can slightly injured. So that is called concussion. So avoid that kind of injuries. Then ACL and TCL. ACL and TCL. ACL and TCL. So that is ACL is injury of anterior cruciate ligament. That is ACL. It is a called torn ACL. So that is a the ligament which is present in the center of the knee joint. It can be broken. Then there is a MCL, torn MCL injury, torn MCL. So that is medial collateral ligament, when the side ligament of the knee joint is broken. The tennis elbow. Tennis elbow is an injury. Then there is a with the jerky movement while throwing the javelin, playing the tennis. There is a injury at the elbow joint. So there is problem in the throwing, so that is called tennis elbow. Then the runner's knee. So runner's knee, when we are running on a hard surface for a long time, that time there can be a pain in the knee, in between the bones of femur and tibia. There can be a friction in between the bones that can be lead to the pain. It is called runner's knee. Then the sprained ankle means when next is sprained ankle. Sprained ankle means when the ankle joint twisted and the ligament and tendons are broken. Then the plantar fasciitis. Plantar fasciitis is the injury of your heel when you are running and heel is stuck with the hard surface. So that injury is called plantar fasciitis. So with this we will discuss the fracture. There are various kind of fractures like complicated, compound, oblique, stretch, transverse, impacted, comminuted fracture, green stick, incomplete, complete. So there are different kinds of the fractures like transverse. It can be in a this way in between the bone. So that is transverse. Then there can be a green stick. So when the bone is slightly bent, like green stick of the tree can be bent, not be broken. So then there be a communicated. Communicated means when there are very small pieces due to any hard object. So impacted when the bone is driven into another broken bone. Then transverse, this is a fracture due to the breaking of bone at the right angle with the excess of bone. So transverse. Then there can be a spiral fracture. So there are many type of fractures, and these fractures can be very dangerous if a person is not taking care of the particular part. If person is not restricting the movement immediately after injuring, it can be lead to the very dangerous injury which can be stay for very long time. So whenever a person is injured, try to take care of yourself, take a proper first aid knowledge, more knowledge about sports medicine. So here again I am discussing that sports medicine is not any kind of medicine which we are taking like other medicines. So it is a preventing, diagnose, curing the injury. It make us healthy to stay away from various kind of injuries. Hope you people will understand the topic. So please subscribe my channel. We will discuss more topics next time. So it is enough for today.